Hi, I'm Micah Larson, and welcome to Pink Pilled, a series of short solo episodes on my podcast, Modern Hysteria, where I break down how patriarchy and misogyny shows up in our everyday life and affects our brains and our bodies. You've probably heard of the red pill and the blue pill from the movie The Matrix, so you can choose. The blue pill will keep you comfortable but unaware of the realities of the world, while the red pill will wake you up to the hard, inconvenient truth. Being pink pilled, in my opinion, would be like waking up not to like a sci-fi reality, but starting to see the real effects of patriarchy, sexism, and misogyny all around you. It's the moment that we realize I'm not alone in this. My body is not the problem, and it's not just me. The system was not built for me. In these pink-pilled episodes, I'm going to talk about the subtle and not so subtle ways women and people assigned female at birth are shaped, silenced, and held back, and how we can start undoing it. So if you ever felt like something was off and no one quite believed you, this series is for you. And because it's March and it's Endometriosis Awareness Month, our first pink-pilled episode is about endometriosis. Endometriosis is a disease where tissue that's similar to the lining of your uterus grows outside your uterus, all willy-nilly, all over where it doesn't belong. It's called endo for short, and it is a chronic illness, which means it lasts a long time, sometimes the majority of your life. And it happens when that tissue, similar to the endometrial lining in your uterus, grows on your ovaries, your fallopian tubes, your bladder, your bowels, even your stomach lining, or other organs, and it can cause a lot of pain and discomfort. We often say that endometriosis is uterine lining outside the uterus, but that's not technically true. It's similar, but not the same type of tissue. That's why treatments that work on your uterus, like birth control, sometimes don't work to treat endo. And it can start with your first period, so in your tweens and teens. But most of us grow up being told that pain is normal and periods just suck and welcome to womanhood, and we're put on the pill without proper diagnosis. Endometriosis affects 1 in 10 women and people assigned female at birth, yet most of us haven't heard of it. 1 in 10. That's more than asthma. It's more than diabetes. Yet a lot of healthcare providers don't know how to recognize it and certainly do not know how to treat it. No fault of their own. This is an example of how the female reproductive body is under-prioritized in our medical system and medical education. Why is endometriosis such a problem? Well, every month your body goes through a menstrual cycle. In theory, your hormones tell the lining of your uterus to grow, and if you don't get pregnant, then your body sheds that lining. That's your period. But with endo, the tissue outside your uterus also reacts to these hormones, and it gets thick, it breaks down, it bleeds all over willy-nilly in your body cavity. But here's the problem. That blood doesn't have a way to leave your body. It gets trapped, and it causes swelling, scar tissue, your organs sticking together. Okay, here's the part that started blowing my mind. In the US, according to Harvard's Law and Policy blog, endometriosis results in an estimated $80 billion in lost productivity. That is a substantial economic impact. We're talking direct medical expenses and indirect costs like lost productivity, like we're calling into work because we're in so much pain, like incapacitated. It's not just a bad period. So what does this feel like? Endo symptoms can be different for different people, but a lot of times it's bad cramps that don't go away with painkillers, pain during and after sex, pain when peeing or pooping, being tired all the time, bloating called endobelly, trouble getting pregnant, and a feeling that something is just wrong even when your test results say you are fine. Actually, endometriosis is responsible for up to 50% of unexplained infertility in women and people assigned female at birth. That is very significant. There are different stages of endometriosis, okay? There are 4. Though you can have pain and symptoms from any of these stages of endometriosis. Stage 1 is minimal. There are superficial lesions in your pelvis, and these can still cause serious pain. Stage 2 is mild endometriosis. There are more lesions, they're more widespread. Stage 3 is moderate. So there are deeper implants of endometriosis in your body, and these can involve cysts or endometriomas, like on your ovaries, and they're filled with that menstrual blood that has nowhere to go. And stage 4 is deep implants and endometriomas and significant adhesions. So the scarring left by endometriosis causes your organs to stick together. And that's sometimes why it causes GI pain. Why do people get endometriosis? We don't know for sure. Some doctors think it's genetic, but others think it may be caused by problems with our immune system or hormone levels, or even like how the body develops in utero, but it's probably a mix of things. And right now, the only way to know 100% if you have endo is to have a surgery called a laparoscopy, XLAP, exploratory laparoscopy, where your healthcare provider looks in your body with a camera. So it's not easy to diagnose. There isn't just like a test we can do to see if you have endo. This means a lot of people live for a lot of years without getting the right diagnosis, especially teens and women of color who are disproportionately more likely to be told their pain is normal. Again, endometriosis affects 1 in 10 women and people assigned female at birth. That is devastatingly common. But, and here's another rage moment, those people often see an average of 8 doctors over 10 years before they are given the correct diagnosis and can be treated appropriately, hopefully. The average time from the onset of symptoms of endometriosis to an accurate diagnosis ranges from 5 to 12 years. That is a lot of suffering. And in that time, patients are often told, you're just stressed, you're overreacting, periods suck. This is medical misogyny in action. Okay, so how do we treat endometriosis? Some people are put on the pill again, but often surgeons use something called ablation to treat endo, which is burning away those endometrial lesions and endometriomas. But this often leaves behind hidden tissue because endometriosis can be all over your body cavity. It can even travel to your brain. And so your symptoms can recur. An excision surgery is where the lesions are completely removed, they are cut out, and it is often considered to be less effective, and it is less commonly performed because it's complex and it takes a lot longer. But again, endo can grow anywhere in the body, so it's tricky. Not just the uterus. Endo has been found on bladder, bowels, lungs, diaphragm, brain. So this is not just a reproductive condition. It is a whole body disease, and there is no cure. Hormonal treatments and pain meds don't treat the disease. They just try to manage the symptoms, which is helpful. But a lot of surgeons are not trained in surgical treatments for endometriosis. Okay, big question here. Why haven't you heard more about this? Because of medical misogyny. The health system, as it stands today, does not take women's pain seriously. So for years, people who have endometriosis are often told that it's in their head or it's just part of being a woman. But we know that's not true. Endo is real, it's serious, and often treatable, and we have a long way to go. If 10% of reproductive age women and people assigned female at birth are affected by endometriosis, that's 190 million people worldwide. But are we going to get better options for diagnosis and treatment? Don't know, because endometriosis research is really dramatically underfunded. In 2022, the NIH, the National Institutes of Health, allocated $27 million to endometriosis research. This averages about $2 per patient. While diseases that have a similar prevalence, like diabetes, receive much more funding. Diabetes, which has a similar patient population, gets an average of $50 of funding per person. Okay, big picture. Endometriosis is a really prevalent, really painful condition, but it is systematically dismissed, devalued, and underfunded because it's a woman's health concern. This is baked into nearly every part of how endometriosis is handled. And because it's not prioritized, this hinders advancements in understanding this disease and learning better ways to treat it. Medical misogyny means we don't get answers, we don't get options, and we are not believed. One of the darkest pieces of endometriosis is that it can cause infertility. And many healthcare providers only really take it seriously if you're trying to conceive, which really reinforces that belief that a woman's worth is tied to her fertility. And most doctors are not well trained in endo care. Even OBGYNs often rely on outdated treatments and procedures, which can make symptoms worse. So a lot of patients bounce from provider to try to find someone who actually listens. Most of the time, we are told to suffer quietly or medicate the problem away. And that's exactly why talking about it matters. Once you see the system for what it is, we can start to fight back. 3 action items here. 1, track your symptoms if you think you have endometriosis. Use a journal to track when you have pain, how bad it is, where is it in your body, your period flow and timing. Do you have fatigue, bloating, nausea? And do you have pain with intercourse, peeing, pooping? And bring this with you to healthcare appointments because you are the expert on your body. And this can be really helpful for diagnosis. 2, ask your healthcare provider the right questions and don't be afraid to get another opinion. You can ask, could this be endometriosis? Do you treat it with excision or ablation? Or are you trained in managing complex pelvic care and endo? Or can you refer me to a specialist? 3rd, learn and share. We need to break the silence about endometriosis. I highly recommend the documentary Below the Belt, all about endometriosis and research, but you can also share this episode. When we speak up, we can help other people get the care they need. And we can fight the silence that keeps diseases like this in the shadows. In the meantime, rate, review, and share this episode of Pink Pilled, and join me next time for another deep dive on the taboos of women's brains and bodies.